Continuing with supine position for ear, nose, and throat, neck, anything in the head area. You want to reverse the table. We have a turn the hand control on, and we have a reverse and normal mode button. You hit the reverse mode button, and when you hear the tone, the table has been reversed, which means the table is thinking in the opposite direction. The table then should be slid to the head end, which is now here. And the reason we're doing that is we're clearing the base away in case the doctor wants to sit, or in case a microscope is required, especially a floor mobile microscope. Remove the head section, and the head section can be placed at the opposite end of the table, or if a special head section is required, or cutaway section for the shoulders, we can do that as well. We have a cutaway shoulder section here. It's going to be placed on the table and the head section attached to it. The nice thing about these sections on the table, once they're placed in, they're automatically locked. To remove the sections, you simply pull the triggers and unlock. Again, placing the section in, automatically locked. Again, a special head section may be required for ear, nose, and throat. We're going to place that onto the table and lock it into position. And that is locked. Now we're going to unlock and reverse the table. Unlock button, you have to hold for about 3 seconds. It's a safety feature to let you, so the table knows you actually do want to unlock the table and you haven't hit the button inadvertently. We're going to now rotate the table so that the head is up here. And of course, if you don't have a microscope case, or the doctor's not sitting, it's not necessary to reverse the table. Again, lock the table, and we transfer the patient onto the table. Once the patient is transferred onto the table and the gurney is taken away, intubation from anesthesia, and usually no arm boards are required for this type of procedure. Again, eyes, ear, nose, and throat, neck surgery. We are any kind of maxillofacial. We are using the space for, again, seated surgeons, leg space, microscope. Once anesthesia has been administered to the patient, again, we're going to unlock the table, holding the button for 3 seconds. And usually what is required is that the table will need to be rotated away from anesthesia. The lines will be thrown to the right, and it is usually 90 to 180 degrees. Surgery, make sure the table is locked down. Following surgery, again, we're going to rotate back to anesthesia, unlock the table, rotate back toward anesthesia, lock the table again, and recover the patient.